Welcome, everyone. Alexis, okay. Welcome, everyone. I'm Alex Coulter. I'm Director of the National Centre for Creative Health. We have about 150 people signed up for this webinar, so people are still coming in. But just to say to you all as you come in, this session is running as a Zoom webinar, which means we can't see our audience, but we would love you to introduce yourselves in the chat. So please say who you are, and you can interact with each other in chat throughout the webinar. We'll be having some Q&A later on, and at that time, could you use the Q&A box, not the chat, for your questions? And there will be a short break in the middle of the webinar when you'll be able to put your questions in the Q&A box. We will be recording the session. You aren't visible, so that shouldn't be a problem, and we will be uploading it onto our YouTube channel later, and we'll be sharing that link with you and anyone who isn't able to be here who has signed up for the webinar. So first of all, I'd like to introduce you to Baroness Molly Meacher, who is Vice Chair of the All-Party Parliamentary Group on Arts, Health and Wellbeing, who will be chairing the session today. Thanks, Molly.
Thanks, Alex, and welcome to everybody. How wonderful to see you all at this very first roundtable of the Creative Health Review on the theme of mental health and well-being across the life course. The National Centre for Creative Health, NCCH, together with the All-Party Parliamentary Group on Arts, Health and Wellbeing, will be running this Creative Health Review over the next year, aiming to highlight the potential for creative health to help tackle pressing issues in health and social care more widely. You can find more detail about the format of the review and its themes on the NCCH website, and we've provided a link to that in the chat. And we also welcome your own submissions, and I do want to emphasize, we really want you to send in your own experiences or evidence or anything you have that would be relevant to the review. And again, further details can be found following the link in the chat. And I want to say, I'm not here just as some sort of distant and disinterested individual. As chair of the Mental Health Trust in East London, we did a huge amount in introducing art classes for artists, and we had art therapy that was quite different, but this was art classes for artists. We had bands, we had different music groups and so on, as well as sporting things like a football team and a netball team. So, these things transformed our people's lives, and it was very, very obvious that the transformational impact, if you like, of all these activities. So I'm passionate to hear what you've all got to say today. This roundtable session will highlight, in fact, the vital role for creative health in supporting mental health and well-being. And of course, we know that more and more people are suffering with mental health conditions, particularly after the pandemic and with all the difficult economic situation that we're all facing. So it's absolutely vital that we find ways to support people with mental health issues and to help their well-being. As we'll hear this morning, there are numerous ways in which creative activities and approaches can be used. And I think a very important part of this, it seems to me, it always seemed to me, is that in undertaking these activities, of course, you're automatically doing this in a group. And the very fact of being in a group, making friends, developing relationships, is all a very, very important part of the benefit to mental health and well-being. And of course, creative health can be used across the life course and across a spectrum of mental health conditions. So with the government currently consulting on a long-term plan to address mental health, we know that the huge contribution that creative health can make to this. And we want to bring together the most recent evidence and examples of creative health in practice during the review in order to bring those to the attention of the government. So today we have a fantastic panel of speakers with vast experience and knowledge around mental health and well-being and the application of creative health. And the panel will introduce themselves individually with their mini presentations. But I want to start by asking NCCH trustee and creative health advocate, Debs Teal, to introduce the session by providing her own perspective on the value of creativity for mental health. So over to you, Debs.
Thank you, Molly. I'm Debs. I've been in mental health services from childhood, and I've only really ever known those services develop as time went on. And 12 years ago, I reached crisis point. And when I say crisis point, I ended up taking an overdose. I was told by the psychiatrist that I would always be ill, I would always be medicated and never work again. At that point in time, I was on 21 tablets a day. I was often bedbound. My children were my carers. I've been medically retired from my last job, so I believed every word the psychiatrist told me. And I felt I'd been given a terminal life sentence, which I didn't particularly want to live with. I felt a burden to my daughters. I felt a burden to society. So I took the overdose thinking that it would give my daughters freedom and get rid of this pain that nobody could deal with other than giving me more medication. Woke up in hospital, furious that I'd failed. And part of being discharged from hospital was that I had to go to psychology. And whilst I was waiting there for the assessment, I saw a leaflet, Creative Minds, Art for Wellbeing. I don't know why I picked the leaflet up. I've never been creative, never been artistic. My children used to joke about the state of my drawings when we play quick on the draw, but something made me pick the leaflet up. There was an art class really close to my home, which was starting in a few days' time. So I took it in when I went to see the practitioner, and they didn't know a great deal about it, but said give them a ring anyway. I rang the number and they said just come along and try it. It's a taster session, so I didn't need to commit to anything. So my friend dropped me off and then politely drove off, so I couldn't go back home straight away. And I sat down at the art class, and that's the day my life changed. That's the day something inside me offered hope in a way that I'd not felt within the services that I'd had. And I've just grown from strength to strength from that 12 years ago. I've been off all medication for 10 years now. I've been out of services for 7.5, and I work in the same NHS trust as the expert who told me I'd never work again for. I just feel that the impact on me was way beyond anything I ever even imagined. I started doing talks initially to service users because I thought I had no hope, and he literally threw me off a cliff, and I need to give other people hope that there is something out there that can help us. And from there, experts started asking if I do talks at their events, and I'm like, gosh, what do these experts think I can tell them? But I soon learned that we're all experts of ourselves, and nobody can go to any university, get a degree on what it's like to live in my shoes. So that's why we need to work together to make this sustainable for all of us, because services are struggling. So if we can offer different ways and means of sorting that out. And the art classes that I did for just short of 2 years cost less than 1 year's medication alone. They did a social return on investment. They got up to £33,000 a year. So I'm saving money by just going to that, doing the art class. I mean, I don't go to the art class anymore. As you can see, I do art at home now. It's still my well-being tool. And I think the difference that creativity made to me was because it focused on my wellness and not my illness. Services had just focused solely on the labels that I had. It focused on the medication that I was on, whether it was working, cocktails of this, cocktails of that. And the art was very different. It gave me time and space to help me deal with things myself, to work things out myself in a way that was right in the time for me. And the impact I've made, not just for myself and my daughters. I mean, my daughters are over the moon that the mum was saved, but also they've seen me grow. They've seen me push boundaries. They've seen me question things and disagree with quite a number of people on certain issues that I think aren't right, because I still speak from a service user perspective. I still speak for the vulnerable who don't often have a voice, and I want people to have a voice and a choice in their care, and I really advocate for that. The reason I like creativity and why I think it should be available, certainly within people with mental health conditions, we have been quite restricted in what we offer people with mental health conditions. So certainly most of my care was medication and counselling. Both have quite bad side effects. The medication alone was horrendous side effects, which is what often left me bedbound. And it's the side effects of painting is I get paint on me. It's just negligible, you know, it's just so simple and easy to do. If it's a sport, you know, creativity, doing sport, then you might get an injury that way, but it heals. And it's looking at more positive ways of people to not just do something creative, but to get social again. Because one of the things people with mental health do is they isolate themselves. They remove themselves from groups, they unfriend people on Facebook and Twitter, because they don't want people to see how dark and negative they're feeling at that moment. They want people to be happy and joyful. So by taking themselves away from that, that removes them. So just to finish off, a little update. I sold 168 paintings. I've had an exhibition at Canary Wharf in London. Last year, I had a piece in the United Nations International Art Exhibition. I've won awards. I've been to Buckingham Palace, Clarence House, House of Lords, Houses of Parliament, spoke at NHS Expo, shortlisted candidate for Yorkshire Woman of Achievement. And I don't say that with a big head. I say that as I've been an invisible service user all my life. I've never had an identity until I took up art. I've never had a purpose until I took up art. So that's why I advocate so much for creativity, because it gave me hope when the system, I mean, it was struggling then, it's struggling even more now. And I think certainly from a young age, we need to bring back creativity in schools. We need to start working on children's mental health. To me, that's priority over maths and English. You can catch up with that at any age. Your mental health is priceless. Thank you.
Well, thank you very, very much, Debs. That was a complete inspiration. And really says it all, frankly. Listen to some more people who can really teach us a great deal. Gabby, Gemma, Georgina and Rod from 42nd Street we now hear from. And I gather this is 42nd Street's 42nd birthday today. So congratulations on that. And thanks for being with us as a little break from your celebration. So I don't know who's going to speak first. I'm going to leave it to you, but it's over to Gabby, Gemma, Georgina and Rod from 42nd Street.
Thank you very much. Thank you. And yes, lovely to see everybody. So I'm going to start. So I'm Rod. I'm the creative producer at the Horsefall, and the Horsefall is part of 42nd Street. 42nd Street is a charity, mental health charity that has been running 42 years. With a strong youth work element, and we support young people 13 to 25 in the Greater Manchester area. We offer various forms of counselling. We offer one-to-one counselling in kind of community settings, universities, schools, in communities and at our own building. And then about 5 or 6 years ago, the building next door became available, and a young person said to us at the time that you should do art there because that's good for mental health. And luckily they did, and that's what we've built up. I've been here about 4 years, and we've kind of moved from I think initially when I moved, it was kind of project-based work. And what we've moved into is to a real investigation of what creativity does and how it works. And I think the young people are very much a part of that. So the access the space for projects, but also for drop-ins, where there's no kind of expectation to produce work to be shown. You know, if you think of our secondary school kids, there 90% of the school day is tested. And actually, whereas as adults, we don't draw because we feel judged, young people quite often find freedom in that creativity. And I think that's what it's really offering our young people, is some kind of liberation. It does so much. It's that kind of 2 hours away that you don't notice what you've been doing. It's a kind of, it's an action. And I think that's really interesting. You know, when you're struggle with depression, sometimes doing even the slightest thing becomes difficult to do. And I think actually putting that pencil on that piece of paper and making a shape or whatever is an actual physical action. And it's also a realization that we're here. We create, therefore we exist. We create something that's not existed in the world before. It also has a kind of reflective aspect. So we find young people doing journals or sketchbooks that are looking back on those. And again, not always a public thing. You know, as a young person who comes to our groups and she'll say, you can see that page. So that's the page I can see. But the other pages perhaps no one will ever see. So it's for her. And that's really what we get, is that, like Debs was saying, it's accessible 24/7. You know, we had a young person at our symposium last year said, my sketchbook's there at 2 in the morning when nothing else is. I can say anything in my sketchbook and write things out. So it's got that kind of cathartic stuff. You know, as we all probably use art in the sense of taking a photograph to reaffirm positives in our lives. We take pictures of celebrations, birthdays and events. So too do young people use their art in that way and reaffirming positives. But also they might be processing negative experiences as well. And we'll talk about that with Gemma when I link on to Gemma. So it's got that aspect. And then also, it also has this very public thing of, you know, through young people using art to tell their stories. There's that Jungian thing of becoming outside of a situation. But also it's very good for adults to understand the experience of young people. So if you think in Manchester, where we are, there's 50% of young people living in poverty. That's a really difficult thing to conceive and have a concept about and to, you know, to kind of understand. But if we put a camera in one of those young people's hands and say, take one picture every hour during the day, we're understanding, we're literally seeing through the eyes of that child. So we're understanding young people from that. So what we're really doing is kind of continuing to kind of explore what creativity does. My background's in kind of social care, children's rights and participation, working in lots of care settings. So it's about that kind of nurtured support. You'll understand a lot of our young people come through the door are anxious, and creativity itself can be an anxiety of producing something that can be judged. But we're trying to really look at that process of creation and look at what that does and how young people want to use it. So it's very much that young people come through the door and we kind of offer a bespoke process for them to, bespoke way for them to engage in creativity. Whether that's privately, whether that's just coming to the drop-in, where they just work on their own stuff and there's that social aspect like you were saying, or whether it's them furthering an idea, or whether it's them processing experiences they've had before. So we're really looking at lots of different ways that this magic thing called creativity works. And I think if we look at childhood development, young people learn how to draw and use colours at the same time they're learning languages. And the adult world can quite often ask children to step into that adult world, especially young people in care. And also in some terms, counselling, you know, the one-to-one in a room. Even our CEO, Simone, who really supports creative stuff, said that puts a lot on a young person that they can express themselves verbally. In a room, to an adult, in a room that's usually quite small, and our counselling rooms are lovely, but it relies on people being able to process as they talk. And I think art offers that kind of space for them to reflect and return to work. So I'm going to go pass you on to, so we've got Georgina here who works with us. She's a mental health practitioner linked to all the work we do. She's going to talk about some of the work we do. And then we've got Gabby, who's a young person, but also you'll find out that we've commissioned her as an artist. So has been through support at Port Secretary, and then Gemma as well. But I'm going to pass you to Georgina first. Thank you.
Hi, nice to be here. So I really want to talk specifically about the drop-in that we run here, because I think it's a really important part of how we work. And I run the drop-in. So normally we'd get a referral from the main service, and then calling it a referral is probably the most clinical part of anything that we do. And from that point, nothing is like how it usually is. And it's always about building up a relationship with the young person. And I'm actually even trying to get the name referral changed, because I just think it also puts people off when we try and be like other mental health interventions. In that we don't even really call the drop-in a mental health intervention, but as Baroness was saying, you know, even coming along and being a part of a group is good for your mental health. So the drop-in is every week for 2 hours in our beautiful creative space. And again, even just being in a creative space for some people is disrupting like the monotonous like places that young people have to be in, or the clinical places that young people find themselves in, where you have to behave or act a certain way. And at the drop-in, you can really be whoever you want to be. And it is a creative drop-in, but there's no pressure to be creative. You can just come in and sit, and you don't even have to introduce yourself if you don't want to. As Rod was saying, people can be quite anxious when they first come in, and there's literally no pressure. But we find that people can come in first few weeks, be a bit quiet. We usually get about 12 to 15 young people every week, which, especially if you're anxious, can feel a bit overwhelming, but it's such a welcoming and friendly, warm space that within a few weeks, the people that are really quiet, we normally can't get them to stop talking. And we have snacks, and we do I normally have like a creative prompt or materials to explore. And that is really where a lot of the young people that come in, it's the first time in years that they've been given permission to be creative, because, you know, in school, especially in high school, only certain young people are encouraged to carry on doing art. You're only told you can do it if you're good at art, and that means if you can draw or paint in a certain way. And I think the art in schools really limits what creativity can be. And so at the drop-in, we really try and introduce people to creativity, show that it's for everyone, show that there's no right or wrong way of doing things. And yeah, it's a place that people can come to every week. So we've had some people, and there's no, you know, if you've not come for a few weeks, it's not like, oh, you can't come again, which again is unusual in like certain clinical interventions. So I've recently had an email from someone saying, oh, I've not been for 2 years, can I come again? Like I can feel myself struggling a bit. And it's like, they know that when they are struggling, they can come here, get support, be creative, meet other like-minded young people, but also they don't have to say to the people, oh, I'm going to go to, you know, a mental health charity. They can just say, I'm going to a creative drop-in, and then people are like, oh, that's nice. Like there's so many different layers of why it works and why it's right for people. And I just think it kind of can go unnoticed, like our creative drop-in that nothing's necessarily made, but actually it's really important. And I think it's a really integral part of how we work. It's how we get to know young people and then go on to other projects that are potentially bigger and showing the work. But yeah, that's the creative drop-in, and I think there needs to be more of it.
Grand, who's going to speak next?
And then we've got Gabby, who's part of our creative collective. She's going to take.
Hi, Gabby.
Hi. So I started off coming to 42nd Street for counselling years ago, and my counsellor remembered that I enjoyed art and being creative. So she recommended me to the drop-in and the festival that they were doing at the time. And that was like, honestly, a life-changing moment for me, from just going from I'm just doing counselling and that's it, to I'm doing creative things. I'm enjoying my time. I'm having space for myself. So I'm part of the Creative Collective, which was a group for 18 to 25-year-olds that we run here. It's for the older people who kind of know that they want to go into art and creativity. Everyone's already got an interest in common with the rest of the group. So it's a really good space to meet like-minded people who you've already got interests with. It's much easier to talk to everyone in that group when you already know, oh, so-and-so likes photography. I can relate to that. So-and-so did this over the weekend. I can tell them about how I've done this before. And in that group, we're kind of all getting the same opportunities from Rod, because he knows a lot of people. So it's really nice to come into a space and be like, here's an opportunity for you. When you're an alone artist who's maybe freelance, or you don't know the art world too well, or maybe haven't gone to university, you might not be getting these same opportunities or even know where to start looking for them. So it's really nice to be able to say, I know someone, they're interested in working with young people, and actually listening to them, rather than in the past, I know at the Horsefall, they've had people who've come in and said, oh, I want to work with young people. I've already sorted everything, I just want their opinion. And it's not actually wanting to use them and get their opinions and having them shine. It's more like, I just want to say I've worked with young people, but I've actually done it myself. So it's really cool to be able to have that control. And as soon as you come in, it's such a, you know, it's a space for you as a young person. It's not clinical. My artwork is literally up right now in the corner here, and we've had shows, and it feels a lot more like we've got a bit of control, which in a world outside of here, a lot of the time, young people don't have control. I know in like my life, it was literally just things were happening so out of my control. And that was a big part of why I ended up being so depressed. And then trying to control every little thing. So it became such a massive thing to even just make a decision. So to come here and say, look, you can paint on the walls. If you want to paint on the windows, you can. Our windows are always covered in someone's work. It's amazing. So yeah, the Creative Collective is so good just to socialize, meet with other people, get opportunities, and we've done projects together and met like professionals in industries where it's really hard to get into. So to hear their journey and what they think young people should do to maybe get that step up is really, really helpful and so kind of validating, because everyone we've spoken to says, yes, it's a big issue. How do you even get into becoming an art dealer, a photographer, a professional seamstress or whatever? It's like, how do you do this? Especially with maybe you don't take the normal route through university. So it's been really, really good. And I've made quite a lot of friends. And I also took part in the Future is Ours Festival at the Horsefall around last year, where I got to work with a professional artist and we collaborated together to create art. And then I took over fully and made my own piece, and it got showed around the gallery and on billboards and through the Instagram. And it was such a big confidence boost to say, look, we value you and what you think and your art so much. We put it on a billboard. We've put it on advertisements in Stephenson Square. Fred Alders knows about you, stuff like that. So yeah, it's just an amazing place. And I think it's one of the few places I've been where the help comes really naturally. Everyone is so supportive, and we all, like, all the values 42nd Street has and bigs up so much, all of the staff value as well. It's not just we're saying one thing to young people, but behind the scenes we don't actually maybe care about our own mental health. Everyone feels the same way. It's so supportive and validating and kind, which in a lot of other more clinical places for counselling, it's not been the same. It's been cold. It's been, oh, I don't really remember you. Tell me everything again every single time you see them. But here, people really go out of their way to humanize you more. You're not just like a case study. You're a person with value, and they know that. So yeah.
Brilliant. Thank you.
Okay.
So
Thanks very, very much. No,
I think that's so important what Gabby says about kind of allowing young people to tell their stories the way they want to say it.
Yeah.
Saying what they want to say the way they want to say it. Well, and the unique experience of being young and being able to communicate that rather than adults decide.
I think we need to get on to our
right, yes, we've got Gemma now. So yes, I'll pass you on to Gemma.
Hi,
Yes,
I'll try and be brief because I know you've got to move on, but yeah. I was first introduced to the Horsefall probably about a year ago, and I took part in a project over about 7 months with about 7 other young people who had lived experience of the diagnosis borderline personality disorder. And over those months, we worked together to both create and curate an exhibition which brought to life like the lived experience of that diagnosis, the stigma, the struggles, stories, symptoms. And we used a variety of creative processes to do that, like pottery, painting, poetry, loads of different collage, so much stuff. And it was a really interesting opportunity for me because I'd done so much therapy like my whole life basically, but I'd never really used creative methods. And I think I could really like tell you about all of what we did there, but I wanted to really emphasize that sometimes when you're introduced to art, it can really unexpectedly kind of like change the way that you view art, and it really made me reevaluate what creativity can do for my life. Because I think it's quite easy as a young person who's like going through school or college or uni to just be quite like speculative and undermine putting time towards art for their mental health, because you might think, oh, I could be doing something more productive. But it honestly like changed so much for me to just be able to have that time where I was allowed to just sit there and like relax and express myself. And I was able to do that in this building, and it became very much a safe place to socialize and process and relax. And I think youth loneliness is such a big problem post-pandemic. So I think, I mean, we're a year after the pandemic, but like it still really affects young people within everyday life. And I think being in a room where you're all working towards the same goal, maybe you're creating different pieces, but it's a shared vision. And I think that was really invaluable to just be able to talk to each other about what you're creating, but do it in your own way. And it gives you a real sense of freedom, I would say. I think we're often like made to feel unwelcome in different parts of Manchester or the city, wherever you live. You told you don't belong here, or you need to be quiet, or like don't go to this club. So being able to come here was like, oh, like I can just relax and be all of who I am here. And I got to really express myself through the pieces that I created. The pieces I produced for the exhibition involved both painting and breaking plates, which in any other circumstances, they'd be like, no, that's unsafe, don't do that. But for me, it really helped me to like process a lot of trauma that I had through both the painting of the plates, what they had, but it gave me a lot of agency to then break the plates. And it's just kind of like an atmosphere where like you can go, I want to do this, and somebody will say yes. And I think a lot of the time, like I'll have all these ideas and people will be like, half the time I won't even share the idea, and then the rest of the time I'll just be told no. Whereas like you come here and you go like, I want to do this, and Rod will just be like, yeah, we'll sort that out for you. And I think that's quite empowering, really. And I think I've said this to Rod, it's quite a nice balance between self-care in that you get to do whatever you want to do, but also you're cared for because the people care about you, and it's facilitated through that. And I think it comes with a kind of flattened hierarchy where we're all equal. It's not like they're a counsellor on your one-to-one or your psychiatrist that doesn't really care to you. It's quite equal, really, and I think that's quite powerful. Yeah, it's just, I guess the sense of agency it gave me kind of the confidence to pursue my own other bigger projects. So I started doing arts-based mapping with a local artist, where we've kind of launched a photo competition to shine a light on everyday therapeutic parts of the city. So I found that really fun to like build new skills, and I think this is about mental health and wellbeing across the live course. And I think the opportunities which we've been given through the Horseball, like what Gabby's done, but also me in collaborating with Dave Draws, it's given me skills which are actually employable for the future as well. So it's not just about coming into the room and processing the past and the present. In coordinating different projects, you're developing like project management skills, leadership, teamwork. I've even like had to work out how to like recruit participants and put like things on social media. So it's been like working with researchers and stuff like that. Like you learn so many skills that better your future when at some point you're not even able to like imagine one for yourself, and now I'm creating one through something that I'm genuinely passionate about.
Okay, well,
I think
that
I was going to talk about the research.
I think we've slightly run out of time, actually. I wonder, I mean, that was absolutely wonderful from all four of you, actually. Absolutely wonderful. Can I just say that we're very keen to have your recommendations to government. So can you just make sure that you do let us have those? But thank you, all four of you, for really very, very special contribution to this event today. So thanks a lot, and enjoy your celebrations for the rest of the day.
Thank you very much. I think Gemma's going to stay with you, but we'll have to go. But thank you very much for everyone's time. Please do get in touch if you want to speak to us at all.
Lovely. Thanks ever so much. That's wonderful.
Cheers.
Okay, we are slightly running over time, but we're now moving on to our panel discussion. And we've asked each speaker to introduce themselves and their work briefly in response to two key questions. What are the current challenges in mental health and well-being? Well, we know some of those, but I'm sure you can help us to develop that further. And secondly, how can creative health activities and approaches help to mitigate these challenges and contribute to a mentally healthy society? Now, we have 7 speakers, and I believe that Dr. Daisy Fancourt is going to start, Associate Professor of Psychobiology and Epidemiology and Director, World Health Organization Collaborating Centre of Arts and Health, UC, and also UCL, I believe. Daisy will discuss the research evidence for the use of creativity in mental health. So over to you, Daisy.
Thank you so much, and it's such a pleasure to be speaking today. In terms of what the current challenges are in mental health and well-being, I think there are 3 that we have to be very aware of. The first of these is the rising burden of mental health problems that we're now facing as a country. During the pandemic, there was a 25% rise in the prevalence of mental health disorders in the UK. And on top of that, we're now going into a recession. Just to put it in perspective, the 2008 recession, within the first 3 years alone, led to an estimated 30 to 40,000 excess suicide attempts and 1,000 excess suicide deaths. So that's above and beyond usual levels. And so I think we have to take very, very seriously what the impact of the current economic situation is going to be over the next few years. And at the moment, we're not really seeing any proper consideration of what that impact is going to be or how we're going to address it. The second mental health challenge is that we have very insufficient mental health service capacity at the moment. Over 1.6 million people are currently waiting for community mental health care. For example, for young people, we know that these waits can be really substantial. Over half of young people are waiting more than 4 months to be seen, and over 3/4 actually deteriorate whilst they're waiting. So we can't rely on the existing system because it's simply not getting the resources and funding that it needs. And there's also a third challenge, which is around the way we approach mental health. First of all, our definitions here are not good. 8 million people last year in the UK didn't meet the thresholds for being offered mental health support because they were just falling short of binary cutoffs. And we really can't continue to treat people's mental health as a binary, especially given we know that mild mental health problems, if they're left untreated, can become more serious over time. And then there's the sort of second part to this challenge around our approach is around treatments. We still focus on mental health as though it's an individual problem, something that needs to be solved at the individual level, whether that's with a pill or with a psychological shift in our way of thinking. Now, we know that there are challenges with both of those approaches. Pills don't always have good efficacy, especially for mild and moderate problems, and also for young people. And flagship psychological programs like APPGAHW simply don't have the capacity to meet demand and aren't managing to reach all demographic groups. But there's also a bigger problem here, which is that mental health issues don't exist in our heads in a vacuum. They're products of the societies that we live in. And it's those very societies at the moment where the circumstances seem completely bent on doing everything possible to make our mental health worse. So I think we have to be very, very aware of this highly complex ecosystem around mental health at the moment and the multifaceted challenges. And as a result, I think we need other approaches that address the whole picture of mental health. So looking at causes, triggers, and the broader psychological, social, and behavioural symptoms and consequences. And we also need approaches that help to address stigma and shame, demographic and cultural barriers to help seeking, and approaches that give patients choice, autonomy, and holistic care. And this is where I think creative health comes in. So as a scientist, I'm focused on what the evidence base is on this. I head the social biobehavioural research group at UCL, where we look at this issue in a lot of depth. We published the World Health Organization review on arts and health a few years ago, where we've summarized a lot of this evidence, and I'll put a link in the chat to that. But I think there are 3 broad takeaways that we can think about how the arts can help with mental health, and they're on a spectrum. So the first of these is looking at prevention, and what we do know very clearly is that the active provision of arts, culture, and community activities within societies plays a clear role in helping to prevent the incidence of mental health problems in the first place. So just as an example, our work using international cohort data where people get tracked at population levels for decades has shown that adults without mental health problems who engage in arts and culture have about half the risk of developing depression over the following decade, even when we've taken account of their socio-demographic factors and their other behaviours. Now, we've published over 70 different papers now that have looked at these kinds of relationships through big data. They are heavily statistical and not easy reading, I know, but we're just publishing in the next few weeks a summary lay report about all the findings from these. So again, I'll put details on where you can find this, but we have this population level data. The second takeaway, I think, is around the fact that unfortunately, even with these activities, not everybody engages equally. There is a social gradient in participation in arts and culture that unfortunately mirrors a social gradient in mental health fairly closely. And this is based on demographics, socioeconomic circumstances, life experiences, where we live, etc. So we can't simply tell people to engage in arts and culture. We need to be more sophisticated about how we help them to find those routes in. We know that things like provision in schools really helps to remove the social gradient between children. We also know that things like social prescribing can help to bring other people in. And our analyses of population level data in electronic medical records have shown that social prescribing can help to reach lower income and more deprived groups. And then my final takeaway is that we can also look at bespoke arts and cultural activities that are targeted to specific mental health needs. There are so many examples that you're about to hear about, but there's real opportunity for expansion of these. For example, with World Health Organization, we've been working to expand our postnatal depression project across Romania, Denmark, and Italy using singing in communities. And we're just launching a major program in child and adolescent mental health services using social prescribing for people who are on waiting lists. So I'll put links to how you can find all of our papers, reports, briefings and infographics, and also how you can sign up to our newsletter. We're also just going to be organising a database of all of our papers on our website, so you can search by tags and keywords. So we hope that this evidence will help in this process. Thank you.
Thanks ever so much, Daisy. That was brilliant. We are increasingly running a little bit over time, so if everybody can stick very carefully to their 5 minutes, that'd be really helpful. We're now going on to Kiz Manley, Hip Hop Heals founder, tutor, counsellor. Kiz will tell us about her work as a practitioner using innovative approaches to work with communities experiencing inequalities in mental health. So Kiz, over to you.
Hello there. I'll try and keep this short and sweet to make up for the time. I just want to make a correction. I'm not a counsellor, I'm a therapeutic hip hop facilitator. Okay. So I've been thinking and working very hard to assess and to take action on the inequality around creative health. So during my career, I discovered that I was somebody who has PTSD and trauma, but it's never been diagnosed over a 20-year period until just last year. And this is despite having presented with very, very traditional, like standard symptoms such as flashbacks, cycles of depression, and so on and so forth. So as I started to use self-care creatively to manage symptoms that nobody had explained or offered a solution for, I started to firsthand discover the power of creativity to process things. And for me, it was through writing. And then I trained as a therapeutic writer and started to think about how writing would appeal to different types of people. I just want to recognise that we've started with some excellent talks by young people, and it was great that we've included young people's voices here in this roundtable. What I'd like to also highlight is that we don't have any African Caribbean people, or that I can see, and Chinese people, Romani people, so on. We are a global majority. So the first point I wanted to make is that we're constantly excluding global majority people from these conversations. And so how can it be that people from these backgrounds are going to have anything other than inequality when there's grand narratives around race? Only 3 generations ago, our ancestors and our predecessors were under colonial rule. And the spaces that we're in can be incredibly intimidating if we don't have titles. We've got, with the greatest respect, we've got a lord, a baroness, a doctor here. And if we are to influence policy in an equitable way, We need to make space for people to speak without feeling intimidated or needing a university degree like the young people said from 42nd Street. The second point I wanted to mention is that young people and men in this country are facing suicide rates at an unequal rate. And this is a huge concern, because if our children and young people are at most harmed by themselves, I really think we're failing as a society. And this has got to be the most pressing matter for us to be looking at, the fact that our men and our children are taking their own lives and it's not disease. So I want to highlight that, you know, the creative arts and health systems that we have coming into play now, who are they appealing to, and how are we targeting men and young people in creative arts provision? What is it that men like to do? What is it that makes men feel good? And young people, what are they doing? What do they listen to? What do they like to feel? And how are the creative health and the art systems that we're starting to promote looking after them? There's an idea about science being the be all and end all, but actually with trauma and traumatized people such as myself, Deb's mentioned earlier that, you know, it's not a one size fits all with treatment, and, you know, people who are suffering from mental health in the system, poor mental health, going through a system can be invisible. There's lots of evidence from hugely knowledgeable speakers going around the world, like Dr. Gabor Mate and Dr. Bessel van der Kolk, who are showing the link between things like mindfulness, breathing, yoga, the arts to help process trauma. But these aren't things that I'm seeing offered widely or in a culturally competent way across, for example, social prescription services. So while the social prescription movement seems to be taking off, as an individual on the ground asking for a link worker to call me in a time of crisis with a huge PTSD relapse, it took 6 weeks for the doctor surgery to get back to me, and the receptionist didn't know what I was talking about when I asked for the link worker. So I just want to recognise that sometimes we might be putting systems in place, but are they actually working for the end user like myself and Debs? That's what I'd like to leave us with. Thanks.
Well, thank you very much, because that was certainly a challenge anyway, and we'll all take away your words and think about them carefully. Right, David Cutler, Director of the Baring Foundation, we're going on to next. David will provide some insights from a funder's perspective on creativity and mental health. So over to you, David.
Thank you very much, and I wanted to congratulate NCCH on doing this review. We're very proud to be supporting you. The Baring Foundation's a human rights funder, and we fund the arts, participatory arts, with people with mental health problems. And before this meeting, I was a bit worried that we might be reducing the arts to medicine. I think there's all sorts of reasons why we should be supporting arts and health, and that shouldn't exclude treatment and well-being, but it should also be concerned with rights and access and expression, storytelling, liberation, not being in a clinical space, all those things. And I think people have emphasized that in a very powerful way already. Daisy's just said that we're talking about a complex ecosystem, and I want to spend just a couple of minutes talking about the arts side of that complex ecosystem and the sorts of arts organizations that we're supporting. So since 2020, we've now supported 130 arts organizations with grants. I'm absolutely delighted to say includes Kiz, and it was really, really good to hear what she was saying. And part of the approach that we've taken to that is indeed echoing some of the things that Kiz has said, that when one looks at the, if you were to call them the arts and mental health workforce, the participatory artists, the arts organizations that are working with people with mental health problems, our focus. She's right, it's a very white and middle class workforce. It's actually a very female workforce. That actually isn't so true of the NHS as a whole. It is true of psychotherapy and arts therapy. And therefore, quite a lot of what we've been doing is funding to try and increase opportunities for artists of colour who haven't previously engaged in arts and mental health to start doing that now. Looking broader than our funding at the arts organisations that are concerned with engaging people with mental health, we've noticed a number of things. There's an awful lot of them, perhaps more than you might imagine. We've got a directory that's got 320 organisations which either exclusively work with people with mental health problems, or it's a really major strand of their work. We asked the Centre for Health and Wellbeing to do a study, Culture, Health and Wellbeing Alliance, I can never get that right, apologies. And they called that surviving and thriving. I either think the thing about those arts organisations is they're surviving but not thriving. Many of them are very small. When we funded 90 specialist arts organisations, half of them had a budget under £100,000. A quarter of them had a budget under 30,000. They're micro organisations, they're very local. They're often extremely experienced. I've probably spoken to 100 artists who are working in this field across all art forms. I can't immediately remember anyone who said that they hadn't come into working with people with mental health problems other than it was their own experience. There's a tremendously large element of lived experience amongst artists. And let's face it, they certainly aren't going into it for the money.
David, can we just say we're sort of increasingly running over time, if you can try and wind up.
Well, it's probably my only virtue that I am very good about time. So I will finish with one point that we also need to think about the mental health of artists, that there's a crisis in the mental health of artists. They are much more likely to experience mental ill health and distress than other people. Thank you.
Thank you very much indeed, David. And sorry to interrupt you, but I'm getting a bit worried about time. So over to Stuart Smith, psychiatrist, psychotherapist, and author of The Well-Governed Mind. Over to you, Sue.
Thank you very much. I'm getting a lot of feedback.
Yes, can people mute themselves if possible?
Right. Okay, so yes, I'm a psychiatrist and psychotherapist. I worked in the NHS for many years, running a district psychotherapy service and becoming the lead clinician in psychotherapy for Hertfordshire. And I now work in a service that supports doctors suffering from stress and burnout. It's a service called Doc Health. So that's my professional background. And I spent 5 years researching and writing a book about gardening and mental health called The Well-Gardened Mind, which came out at the beginning of the pandemic. So what I'm going to say in a very brief summary draws on that, but it also draws, and I want to sort of bring a personal element in, on our experience here at home in Hertfordshire, where with my husband, we've been developing a community-based project working with 2 mental health charities in an orchard very close to our home. And one of those is a local youth counselling charity called Signpost, and they've started a vegetable growing plot in the orchard. The other is a charity called Sunnyside Rural Trust, which works with adults with learning disabilities. And they are setting up a nursery in the orchard, but will also very importantly help us link in with social prescribing so that we can offer social prescribing to our local GP practices. Currently in this part of North West Hertfordshire, there isn't a garden that social prescribers can refer to. So I guess one of my messages out of this is for people to think about, in terms of NHS resources, where is there unused land or space, backyards of clinics, or, you know, unused front gardens even. There's a very good example of the Lambeth GP Food Cooperative, which has set up small gardens in I think 11 or 12 of the practices in Lambeth. So I just want to say, just to give people a quick idea about what gardening brings, because you may wonder, where does gardening fit into this? Gardening is, of course, a form of creativity. Importantly, it brings together human creativity and nature's creativity. And that actually, for some people, is less. Somebody earlier mentioned how daunting it can be to create and put something out there. And for some people, it's a kind of, and it's an accessible way of being creative. They don't have to sort of summon something up from deep inside themselves, but then they can look at what they've done and what they've grown and feel proud of it and excited and share it. I mean, gardens are very conducive to sharing pleasure, sharing produce, and so on. One of the things I want to emphasize, I think, is because we've been talking a lot about things like isolation and bringing people together in safe settings. Gardens work partly through a sense of sanctuary and safety, a sense that this is an in-between space. It's almost as if the ordinary social rules don't apply. And I came across this many times in the research for my book, that people were able to talk to people from a different racial background or a different cultural background across the generations, who in ordinary life they wouldn't be encountering or probably feel emboldened to chat to. So that's important. That affect's being called gardening as a social bridge. The other thing I want to highlight, and I really thought Daisy gave a very good summary, an excellent summary of the state of, you know, mental health issues at the moment in the country and what is facing us going into this recession. But I also want to flag up what's facing us going into with the climate crisis, and particular eco-anxiety, environmental despair, and so on. And for many young people in particular, it's not only young people, but for many young people, this is a very, you know, powerful phenomenon that it can make it hard to feel a sense of a future. So what I want to highlight is the way that gardening, because when we garden, we're working with the natural growth force. We're working with the cycle of life. Gardening is intrinsically future orientated. It sets us off planning what we're going to grow, sowing our seeds, looking forward to something that's coming. All of these things are obviously good for counteracting depression and you know, difficulties with envisaging a future. So you've got that element of it. And you've also got the element of actually coming to accept the life cycle, coming to accept that things die, that there is a cycle of life in nature. This can be very important in terms of coming to terms with loss, for example. And also in terms of regeneration, producing a sense of hope and empowerment, I think. So that this is one thing, small thing, that we can all contribute as a community to growing food locally, increasing pollinators by growing the right kind of flowers. And that, I think, is very, very important for young people at the moment, and particularly young people like the ones who are attending our youth counselling gardening group.
Thank you. Thank you very, very much. Okay, now then, rather rapidly, I don't know whether you can somehow regain a minute for us. Dame Sue Bailey, Chair at Centre for Mental Health. Dame Sue has extensive experience of young people's mental health, and she'll be talking about that. So Dame Sue Bailey, over to you.
Hi, right, I will cut to the chase. I've got a prepared paper, but I'll cut to the chase. Lord Howarth and Baroness Meacher could help us greatly if they would talk in their house, not about a biopsychosocial model to health and social care, but about a socio-psycho-bio model, because everything that Kiz, Debbie and other people have been talking about is the right of human beings, whatever their background, to have a sense of meaning, purpose and control in their life, to give them both psychological support and material support. And we know the prevalence of mental health is increasing. We know the pandemic long-term effects need to be looked at, and I'd like that to be picked up in people out there working in the field. But poverty is the most toxic influence to mental health. And the more you fall into it and the deeper you go, the worse it is. And it's especially bad for children. I think we have to uproot our response to all that we're doing. We are fixed on an illness creating society with inequality, racism, violence against women and girls, and homophobia harm people's mental health from early life onwards. We do not take public health seriously. Prevention at an early stage. We have the mental health workforce doing their best, but they're burning out and their well-being. We've got artists who are burning out. Unless you tell me differently, the Arts Council hasn't yet announced their next year's funding. So they're worrying about their jobs and whether they'll have bread on the table. So that's all a bit negative, but let's get positive. So what can creative health actually do? They can play a huge part in helping everybody in society, but you have to have a framework where you don't duplicate and you don't waste. And in July, they set up the integrated care services across England. I'm privileged to sit on the GM board as their performance and quality lead. And there's a whole series of partnerships there. And the secret is, as people from 42nd Street, this is being done at place in localities. And you can see the comments there coming from the audience who are watching this webinar. And I think what we're in the business of with creatives, and let's not talk about walking in other people's shoes, that really offends me. What we're about is allyship. And that has to be on the terms of the people that we are daring to say we want to help through either funding or what we do. And the Centre for Mental Health have been involved in 3 projects. BBC Children in Need, they survive, living beyond thriving, not just surviving, and particularly shifting the dial, the Young Black Men's Project in Birmingham. And I'll give you all the details of that. But the point of raising these is the same things come out. Allowing people to have a voice on their terms, listening to them, being prepared to fund things that you might otherwise think of funding, and to look at allowing them to have relatable role models and peer support. And I think this is really about us all together as a community. And Kiz, my son-in-law, runs Unity Radio. My daughter runs Castlefield Gallery. My other daughter is a community engagement artist. I am a socially engaged family. But what we need to do is to use intelligent kindness, emotional intelligence, and get beyond our very stuck in the way we've been doing things. And I think this is a fantastic project, but we have to avoid waste and duplication. And your point, David, it's really difficult. What do you do with very small organisations that have to bend to what funders require of them? So I hope I'm being provocative because I want to be. I'm old enough to be provocative. And I am a psychiatrist, I am a shrink, I'm not ashamed of it. It's okay to be a doctor, it's all right, it's okay. But we have to think about whole societies, whole communities, and follow the WHO understanding of what we want for children and young people, which is to be their best selves, so we can have an economically flourishing, healthy society. And that across Greater Manchester is what we're determined to do. So lots of stuff we can send you. So thank you for listening to me rabbiting on and going over time, Molly. But this is a once in a lifetime opportunity. So let's take it together.
You certainly haven't gone over time at all. And thank you so very much. It's a very, very sort of challenging presentation, a very important one. Thank you very much. Right, we're now going on to Salma Yasmeen, Deputy Chief Executive and Executive Director of Strategy and Change, South West Yorkshire Partnership NHS Foundation Trust. Salma will provide insight on how creative health can be used with the NHS mental health services. So over to you, Salma.
Thank you, and I'll endeavour to try and be as
we're fine now. Don't worry, we're fine.
So I won't rehearse the evidence because we've heard that, I think, from colleagues much more eloquently than I could put across all the challenges, but the challenge of rising demand, the challenge of having a workforce that's really tired and the work is relentless, and trying to work in a way where we can respond in a timely and sensitive way to that increasing need, as well as seeing the challenges as a real opportunity, something that as a trust that serves 1.2 million people across 4 places and 2 regional health and care systems. I would say that we've risen to over the last couple of years. We've got so much more to do, but it has given us a real sense of confidence that actually creative health approaches need to not be just complementary or something that we tinker with as a trust, but actually we've got a real opportunity to address some of the underlying issues for people's mental health issues, as colleagues on this webinar have already pointed out. Over the last 10 years, we've invested in creative health approaches. It's been an evolutionary approach in the trust. However, there's been, I would say, one of the key factors has been really strong leadership at board level, which is required. And we've made decisions to invest in creative health approaches when we've been making really tough decisions about what we choose not to invest in during recent times of austerity. The outcomes and the impact of that is significant. The changing workforce, or the challenges around workforce, instead of beating the same old brush, we can't get enough doctors, we can't get enough therapists, we can't get enough nurses, and keep going out for recruitment, we've actually had a rethink about what more could we do to create the right environment, for example, in our inpatient units. How could we partner and use the talents and skills of creative practitioners to come onto our inpatient units as part of integrated teams and to offer what really people need during long, what might feel like endless boring days. So we've really thought about how we expand our workforce, rethinking what the workforce skills are that we need. And that's an area that we're testing, we'll build on, and we'll continue to build on time to come. We're also working with Huddersfield University, I'm delighted to say NCCH, our partners in this work, to evaluate much of the work that we're doing. We are focused on prevention and reaching out into communities and partnering with our place partners to really align health policy and cultural policy to think about how do we help people to live better lives so that they don't need our services, because people will and are experiencing more emotional distress than previously. We're also thinking about integrating it as part of integral approaches in our services, like the perinatal mental health service. We've got a beautiful initiative called the Lullaby Project, where new expectant mothers and new mothers work with artists and create very personalised lullabies. So it doesn't matter what your heritage is, what your culture is, what your age is as a mother, but actually we try and match you with somebody who can help you deliver and develop something personal. There's a real opportunity with integrated care systems, health and care systems, and we heard from our leaders in West Yorkshire at the recent webinar. We've got strong support from the Mayor, we've got strong support from our integrated care system, and that leadership to rethink how we commission and how we give trusts like us permission to use funding in different ways is probably what's needed going forward. And I'll stop at that point. Thank you.
Sorry, I was muting myself. Thanks ever so much. That's absolutely marvellous. Now then, we need to move on. So I'm a bit disorganised here. We need to move on to our last contributor, Anne Longfield, Chair, Commission on Young Lives. The Commission on Young Lives notes the need for further mental health support for children and young people, particularly after COVID-19. And Anne will discuss, again, I've sort of lost this one, we'll discuss some of the challenges and how creative health could help. So over to you, Anne Longfield.
Thank you so much. I'll try to keep up the pace that have now been set. And first of all, well done for doing this. It's brilliant. I think it's really needed and it's a good time. It's the time, if you like. When I finished being Children's Commissioner last year, I really thought there was one group of kids who were at most risk and furthest away from getting the solutions they need. Which are the teenagers at risk. So we set up this commission last year and have looked in thematic reviews at some of the key areas of their life where a better system of support was needed, and mental health was one of those. I'm not going to go through all the figures, and certainly in children's mental health across the piece, it's obviously huge increases, but following the pandemic, we're now at the point where 1 in 6 children have a probable mental health condition. That increases to 1 in 4 for teenagers and older kids. We've got only a quarter of areas where children get to see a mental health practitioner within a 4-week timescale. We've got 4 times increase in eating disorders. And we've got teachers and schools who now say that suicide and self-harm are part and parcel of everyday life or of the school, or certainly every week life. We've also heard that, you know, the incidents that happen have become more frequent and more extreme, and that, of course, the NHS treatment and availability is buckling under the strain of this increased demand. All of that as backdrop, as part of the commission, we went to talk to young people about what they felt they needed and what they felt about their own well-being and mental health. And you won't be surprised to hear, having heard all the brilliant contributions this morning, that they said that actually they didn't want to be over-medicalised. They didn't want to have to visit clinics and speak to strangers and go into a process. They didn't want stuff to be done to them. They felt the system was over-medicalised, outdated and bureaucratic. And what they wanted was to be able to take charge of their own mental health and well-being, and to be able to grow their well-being, and for those that are able to work with them to come to them, if you like, in many ways. So there were really strong, you know, demands there, if you like. And what they said with that, what kind of things they said they want, and again, very much fits with what people have said today. They wanted to be able to spend more time with each other. They wanted to be able to spend more time doing things such as, yes, sports, but they did talk about arts, drama, dance, music, also volunteering. And in all those things, the things that they value about it would be that, you know, there would be no pressure on them. They'd be able to actually spend time together. They would be able to lose themselves in those activities. And as some said, they would be able to escape over thinking things. But I think there's something broad here about creativity that you can really just release and present to the world. The fact that actually, you know, with young people, you've got a generation of kids who naturally and as part of their everyday are involved in creative activities, but it's often online, it's often outside the kind of systems in their life. It's certainly not usually in the classroom. I was told that the average amount of time, I've not been able to verify this, so don't you know, use mine as full accuracy here, but I've been told that the average amount of time that kids get to speak in kind of dialogue in a classroom in an hour is about 9 seconds, or in a lesson is about 9 seconds. But actually, when they're not in school, they're online, they can do their own you know, they can make their own music, they can do their own writing, creativity, film, all the rest of it. So I think we're missing a trick there, and we need to certainly with rooms embrace that. And there's also the fact that for those kids that are most vulnerable, these are often the areas which can open up access to more formal education. So we know that kids that were particularly telling us this were those that felt they were quite marginalized in more disadvantaged communities, often Black boys and Black girls who were telling us this. So the whole debate we've just been having about cultural competence is really important within this. So what needs to happen about it? Well, there's some great things that are going on in different parts of the country. My starting point, you know, your points about a lot of the arts organisations, you know, there's lots of them, they're quite small. Well, my starting point is schools, actually, because there's a massive resources in schools that usually get locked up. And apologies to Alan, I've not changed my tune over the many decades here on this, but to actually open schools after school, during school holidays, during weekends, opens up resources to communities, not for teachers to have to teach, but for community members to be able to, and for kids to be able to get access to massive resources and brilliant facilities in many schools. So opening up that in the community, working with local community groups that young people often will already have a relationship with. It might be youth facilities, it might be other community groups. So there's a trust already there that they feel comfortable with, and this activity is already there, looking out for how they can be able to get more involved in this area. I think there's a massive amount for social prescription, but it needs to be real, and it needs to go to the people who can really deliver on that. And I would also love to see us making more of the talent of adults in the community and really harness volunteering and adults to contribute to creativity and support for kids outside that time.
Lovely. Well, thanks very much indeed, Anne Longfield. Lovely, challenging contribution there. Now then, we were supposed to be having a tiny bit of questions, but I don't think we've got any time for that. What we're going to do, I think, if others agree, is to have our 10-minute break at this point so that we're back on track, as it were, in order that people, all of you, can put your questions into the Q&A, because we're very keen to have a very active discussion session after a short 10-minute break to give you a chance to put your questions in the Q&A and also do anything else, get a cup of coffee or whatever it is you want to do for 10 minutes. So do stay logged in. And at 10:25, we'll start the discussion. So we'll look forward to seeing all your questions on Q&A. And for the moment, we will, I think, have our 10-minute break. Okay, so yes. So welcome back for our discussion. And we have our rather wonderful panel all available. And we have a number of questions. And if we can start off, perhaps, with a question from Sophie Waring, an OT, who wants to find out more about the commissioning enablers and barriers in creative health. Who would like to say something about that? Commissioning enablers and barriers. Anybody volunteering? Not at the moment.
I think Salma's put up her hand, and Sue Bailey.
Oh, right. So Sam. Maybe.
Salma, yeah.
Salma, sorry, Salma. Oh, sorry.
That's all right. So I guess I can talk from our experience at the Trust and what we've seen as some of the enabling factors to develop more creative approaches as a statutory public service body in partnership with culture and creative partners in our communities. I think the key enabling factor is strong leadership and a shared purpose in each of our places. People working together to have a collective shared understanding of what is it that we need to do to enable whole neighbourhoods and communities and particular groups of people to live better lives, or at least to reach their potential and live well in communities. And I think that the way in which health and care is now being reorganised and the freedom and flexibilities that is offering us, I think there's a real opportunity to work on some of those big challenging issues, like children who are at preschool having access to developmental opportunities before they get there, so they've got a better start in life when they get to school. For children that are in school, having access to creative cultural opportunities and learning some of those really important human skills of connection, friendships, relationships that get them ready for the working world. And then for health and care systems like care homes, where people, we need to enable them to live the best lives that they can, recognising that creative and cultural opportunities are really the golden key to some of that, and working together to pool our resources. So I think we've got the right policy context, we've got a real opportunity to deliver through our partnerships in places. But I also think that for big health and care institutions like us, and we have a huge budget, it's working with commissioners having the vision and the foresight to enable us to work differently and to focus on outcomes rather than being very prescriptive about what it is that we might continue to do, even if we can't get the resources to do it in that way, because people need and want different things. So I think there's some of the enablers. The barriers are some of the structural stuff, but I think that's beginning to shift, so we've got a real opportunity.
Okay, well, should we go on to the next question, because we've got quite a lot of them to get through. The next one's from Rachel Deadman. is creative health looking at the impact on the mental health of artists? Interesting. Anybody want to?
Could I say a couple of words, Molly? I'm sorry I can't raise my hand.
Yes, David, I've got Kiz Manley. Can we take Kiz and then you, David? Is that all right?
Perfect.
Hi, I'll just keep this short, David. I think people who practice the arts are often driven there by mental health and the factors that help them to cope with general life, the challenges that we face as artists, poor income, and you know, just constantly justifying our practice to people now in health who think it's a side hobby, that it has no scientific value and is intrinsically a time waste when they're looking at cancer patients or so on and so forth. So, you know, we're bottom of the pile in a lot of the creative health worlds, and we are using the arts from a lived experience perspective of the challenges of modern day society. And yeah, the arts help us to cope. It's a form of self-care. So I've yet to find an artist that doesn't use the arts as a creative health methodology.
Okay, thanks. And David?
Thanks. I'm sorry I couldn't find a hand to put up. I think there's a crisis in the mental health of artists, full stop. That's wherever they're working, whether they're working with in participatory arts in the community or if they're on the stage at the ENO, and there isn't remotely enough being done about the support. And I'll put in a couple of links about studies about the mental health of artists. Arts funders and the government needs to do more about it. When Sue Bailey says that the Arts Council England's not announced its support for artists yet, and that's going to make their mental health worse, well, she's absolutely right, but it's the government that stopped that announcement, not the Arts Council England. So artists have very precarious lives with all sorts of pressures, and there's a few initiatives that are being done specifically around people who are working in this creative health field. And again, I'll put in a couple of links. Thank you.
Okay, thanks very much. Right, our next question is from Andrew McWilliams, who asked, where should the bill for arts in health work be sent? Public health, primary care, or secondary, tertiary mental health services? Okay, any thoughts on that? Daisy. I think you're muted. I think you're still muted. Okay, sorry. Would someone, over to Professor Dame Sue Bailey. Sue Bailey.
Kids is just put everywhere, but I think we should utilise the system we've now got of integrated care systems and work out from the grassroots what we need to do, and therefore how we're going to use the funding we've got across the whole system. So I think the idea of where do you send the bill to, that's sort of old think. We need to get into what are we trying to do. We're majorly trying to tackle inequalities, using the creative arts to be part of this family. And we need to do that across the whole system, at place and at partnership level, at the voluntary sector, at localities, at commissioning within health and social care. So I think the answer lies in the new system that's been created.
Right, okay. Anybody else want to contribute to that? Anne Longfield.
Yeah, I just backed that up. I was going to say pretty much the same. I think ICSs clearly have a massive role to play, and we should just grab that opportunity. But also schools as I was saying, you know, live and breathe young people's well-being and mental health. So there's a huge role here for well-being to be much more part of the everyday of the school, and part of what we see as schools being about. And again, that's not about teachers doing it, it's about seeing much more of a round of how children learn and develop.
Right, okay, thanks. Let's see what else we've got here. Right. Rosie Dow, we've heard so much today about the role of creativity in tackling these massive social challenges. In your view, what sort of traction are these ideas and evidence getting with policymakers? And how hopeful are you that we're moving in the right direction? Very important question, yes. Who would like to try and address that one? I don't know, maybe Alan ought to have a go at this one. It's a bit unfair.
Yes, well, thank you, Rosie. That's exactly what this review is about. And this roundtable is part of the review. And all the brilliant and exciting and challenging thoughts that have been expressed this morning will be recorded, fed through to our commissioners. Some of them are in the audience listening as this discussion takes place. So I think there's two questions, the question about who pays and the question about how we're getting traction with policymakers are, I hope, to be answered through the process of the review. If you go back to the publication of the Creative Health Report in 2017, I think it was the second of our 10 recommendations, which was that government should develop a cross-governmental strategy to promote creative health, to establish creative health as having a really important contribution to make to addressing some of our most pressing policy challenges, including the massive question of inequality, health inequalities, other inequalities. We've had Michael Marmot's research on the social determinants of health. It seems to us that to the National Centre for Creative Health, that creative health has a crucial part to play in addressing these social determinants of health. And who pays? It should be, in very large measure, government across the system as a whole. Schools, as Anne was just emphasizing, of course, but a whole range of departments. Will we get traction with policymakers? Well, I think the dynamics of this review and this process are going to be important because we've really got two purposes. One is to formulate the recommendations that we want to make to government, looking forward to the panelists giving us their particular advice about what those recommendations should be. But secondly, to develop the national conversation through the sort of process that we're all engaged in here this morning, so that the culture develops, so that ministers and officials sense that there's a real demand, a real pressure to do things differently and better. And you're playing your part in that.
Thanks very much, Alan. Very, very helpful. Okay, anybody else want to embellish on that? Maybe not. I'd love to, but I better not. It's not my role. Right, let's have a look. Okay. Right, Alison Barry, is it? Barry. How can NCCH assist in improving the funding situation for arts organisations providing successful creative health projects? Funding is getting ever more difficult in our area. We have lovely social prescribers who refer many people to our projects, but we receive no funding through the social prescribing system. And Derbyshire County Council have just their entire core funding support, or given, I think it means, given their support to community arts groups across the country. Sorry, there's a grammatical thing, but anyway, the main thing is funding, right? Who wants to comment on that rather massive issue?
Shall I just say something, because it's a question to NCCH, and just to say the example of Derbyshire is Derbyshire County Council has cut all funding to their core arts organisations, while at the same time supporting through public health the growth of the creative health sector. So there's a real contradiction in that. Just to say that I'm not going to say we can answer this massive question, but it is a major theme of the review. So we have 7 themes in the review, and if you look at the list of roundtables, one of them is on cost and value. So it's not only about how it's funded, how the work is funded, it's also how it's valued, how it's measured, how the value is measured, how we therefore speak to funders around value and cost benefit and so on. So massive subject, massive problem, but we are trying to confront it head on in the process of the review.
Good, well, that's encouraging. Yes, sorry about that. Blip. Right, next one is from Gavin Clayton. NPOs in creative health sector experiencing indeterminate wait, at least until after November the 17th statement. Is sector prepared for a PR battle should decision be to make significant cuts to ACE NPO awards? If not, what can we do to be more prepared? Right. Okay. Who wants to answer that one? Challenging questions, these. I think people are not coming forward to answer that one. Can somebody be brave? Oh, here we are. Kids.
Could you just repeat the actual question, because there's so much in that.
Sorry, did you? What did you say exactly?
Please, could you repeat the question?
Oh, sure. Sorry. Oh, sorry, I've got to find it again, haven't I?
Molly, can I just say that's a question that's very specific to the situation of Arts Council funded organisations in the country, because we were supposed to get an announcement yesterday as to who was getting 3 years funding. We didn't get it. David Sue mentioned it earlier. I think we can bypass that question.
Oh, right. Okay, we'll do. We got a very long question here. Let's see. Sorry, I haven't had a chance to look at these, so maybe if I can read a piece of it and see if that makes sense. As an organisation, Down Crows UK of practitioners in music and movement who know the social, emotional and personal benefits of our work, how do we make links with those who are looking to partner with creative groups such as ours? I think perhaps I'll stop there, if people have got the gist of that. Have people understood that one? Anybody willing to come forward? Anne Longfield.
Yeah, I mean, I think all of these questions are kind of interconnected and go back to, Alan's points about the review. I think what we have to do is, this is about making the case for a different priority for creativity and the arts in terms of well-being, and about being able to get the policy space and with it the funding behind it. So it's planned, it's seen as important, and it has some long-term standing and security that we wouldn't want to lose. Clearly there's really pressing issues in the short term, which others will know much more about than I do, but I think this is about making the case for a much greater prominence and priority for the issues that the review is looking at.
Okay, thanks, Anne, very much for that. Now we've got something from Alison Barry. She simply says, just cut. I'm not sure what that means. So we'll perhaps go on to the next one from Quench Arts. And this is really a comment. My comment is around social prescribing. We've been taking NHS referrals for years for our projects, but we're always having to have funding for projects in place to be able to do this. Whilst it's good to have investment in social prescribing link workers, in our opinion, there needs to be funding for the arts organisations to actually deliver the work. I wonder whether that's enough of this rather long question. Does that make sense to people? Anybody want to pick up on that one? Or should we take it as a comment just? Sue,
only to say that I hear the same thing again and again from community gardening projects, horticultural charities and so on, that they'd love to be able to deliver more for social prescribing when they receive referrals, but they can't afford to employ more staff.
Right. And
so
Salma,
sorry, really, I think it is the number of it.
Right, okay. And Salma, that's it, okay.
Yeah, just to add to what Sue has said, I mean, that's a really good question. I guess that's also at the heart of this review that NCCH is leading on. That is absolutely the issue, because we know that there's brilliant work happening right across the country. We know that the voluntary and community sector have had an incredibly challenging time, and actually the key solution has to be joining up whatever resource there is in place and really hardwiring some of these initiatives and projects into pathways of support and care in those places. And where it's worked really successfully, for example, in Calderdale, when we've been working as partners, recognising the impact and outcomes, and then saying that actually this is an integral part of what we're offering in place, and we have to find a way of shifting some of that resource, but making a collective decision about that. And that takes some bold leadership, it takes courage, and it takes people thinking differently collectively around that. And it takes time to develop that way of working as well.
Okay, thanks very much for that. Right, and that, we've got actually lots and lots of questions. We won't be able to deal with them all, I don't think. The next one comes, oh dear, computer. It's flipping. Oh dear, 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 dear. It's flipped, so I don't know where I am. The arts, and from Fiona Hackney, I think we haven't done that one. The arts and humanities are being hammered in HE and FE, courses closing, staff being made redundant, including artists, little recognition of the arts' value to wider issues of creative health and society. What are the panel's thoughts on what we can do here? So, redundancies. Who would like to respond to that, if anybody?
I'm sorry, I can't put up my hand, Molly, because I'm in conflict. It's David.
Oh, David.
And I think there just has to be, it's not an answer, but there has to be an element of realism about the review, that the arts are underfunded, creative health is underfunded, and the health system is underfunded. Yeah. So talking about, and other people will understand it much better, the opportunities for ICS, we must always think about this, but let's not have a fantasy that there isn't severe underfunding, which is just about to get much, much worse. That's the reality. And clearly it's a fight for resources, and I'm sure NCCH will be very effective in advocacy, and but it is a battle, and that's what you're about to enter into in a situation that's getting much worse.
Indeed. Okay. Dame Sue Bailey.
Yeah.
Oh, sorry, you're muted as well.
Yeah, I think we would be careful not to descend into learned helplessness. This is a battle, but I think we have to describe very clearly what each sector, whether it's HE or health, can offer, and how we can be helpful to government, and I say that with a straight face, how we can be helpful to government, and what we can offer and bring to the table, and how we may ourselves have to change the way we do things. I think we have to be honest about this, but we're there to be helpful to government. I am keeping a completely straight face, what we're there to do if we want to help people.
Okay, thanks very much. Okay, now a rather interesting question. How has the role of social media helped or hindered the development of creative health in recent years? Sorry, I need to come out of this. I can see this is quite tricky. Who would like to respond to that one? Social media helped, not? Anybody got any ideas? Anne, again, you're mute. Oh, there you go. Yeah.
I guess it's both ways. It's hindered in that social media hasn't created a lot of problems, or hasn't created the problems around mental health, but certainly amplified them and accelerated them. You've got something that's moved in a decade from being something that was relatively emerging into something which has now taken over large chunks of children's lives, including very young ones, and all the pressures that brings. So, you know, in many ways that is a challenge. I guess there are some very good examples of creative well-being online, and that could be used much more as well. So I think, you know, it's unlikely we can turn the clock back now and not have social media as part of children and young people's lives. We have to make good of that, but also look at how we can use it for good.
Right, okay, I think probably we perhaps take our last question at this point. Should we take it from Elizabeth Quinn? There's a real sense from my local patient participation groups that social prescribing should not be a priority in the current climate. Link workers seem to be referring people to citizens' advice and local Weight Watchers rather than connecting with local creative groups or other community groups. There's a real sense of a need to focus on getting the basics covered with the limited resources available. How can we convince local GP practices of the benefits of social prescribing? Now that's important, I think. Is this where Debs would like to come in? Good.
Yeah, there's almost two elements to social prescribing. Social prescribing is not just about creativity. Social prescribing is looking at people holistically. So referring to citizens' advice and Weight Watchers is part of good social prescribing link worker roles. But creativity, it's almost like the second part of it. And some people do one part well and some people do another part well. And some people do the whole lot well. So it's dividing it into the elements that it is. So the link worker role looks at a holistic approach. If that person is in debt, then referring them to an arts class won't perhaps help them quite as much as what referring them to citizens' advice would be. So it's about defining what social prescribing is and separating the creative part to the holistic part of that person, that family, and their well-being.
That's really excellent answer. Thank you very much for that. I think at this point, I need to thank you all very, very much for a very stimulating discussion, and also to thank the people on the call for their very interesting questions. And we haven't managed to answer them all, but we do have them recorded, I think, Alex, isn't that right? So we haven't lost your concerns and we'll be seeking to answer them. So huge thanks to all of you. Now, we mentioned at the start of the session that the aim of the review is to develop a set of recommendations to policymakers, and you've certainly helped us along that road. We have a panel of commissioners with a broad range of experience who are helping us to do that, and some of them have joined us in the audience today. They'll be able to watch the roundtable and take into account additional evidence that you submit via the call for contributions. But to finish the session, we'd like to ask our panel to help by suggesting their own recommendation. What one recommendation, this is to each panel member, what one recommendation would you make to government to maximise the potential for creative health to improve the population's health and well-being? And I'm going to go through you in alphabetical order. Sue B. Sue Bailey. Where's Sue Bailey? You're muted. Muted. You're muted again.
Okay, we need to make the case to governments about why this would benefit the whole of society and everything that they have in mind. What they want is economically flourishing communities. And I think we need to speak to that. That's what they want. That's what they say they want. And I think everything we've said today could be put in a framework, dropped into a framework that would actually answer that.
Thanks very much, Sue. Right, David Cutler.
Thank you, and I very much agree with what Sue just said. I would add artists are members of the community. They are citizens. They have mental health problems, and we need a strategy that has much, much higher priority about the mental health of all artists.
Right, okay, thanks. Daisy Van Court?
Can you hear me okay this time?
Yes, brilliant.
Yeah,
good.
excellent.
Sorry about that.
Off and on again works. My recommendation is to beware about any further cuts or austerity towards the arts and culture and creative industries, because whilst they might seem like easy targets when funding is tight, what we know very, very clearly is that if these things are cut, not only does it reduce the provision for helping people with mental health problems through schemes like social prescribing, but it will also negatively affect mental health generally in the population, increasing the rates of mental illness, decreasing levels of well-being. So we have to really ring fence these as incredibly valuable health promoting assets as well as cultural assets.
Very helpful, thanks very much. Okay, Anne Longfield?
Okay, all of the above, I think, especially Sue's comments, I would say immediately there are things that can be done. I would open up community resources for creative facilities and make well-being an absolute part of what Ofsted look for in schools.
Good. Right, Kisman.
I would say to make sure that the people leading and championing creative health are representative of the workforce, of the population, and use trauma-informed methodologies around creative health, arts, therapies, and so on to inform how we manage health across the lifespan, because adverse childhood events can be hugely the creative health methodologies can be hugely restorative for adverse childhood events.
Mm-hmm. Thanks, Kis, very much. Sue, Stuart Smith? You are.
Yes, okay. I absolutely endorse that. Everything everybody's already said, really. And I think for me, it's about, we know we're facing really hard times. And so therefore, the more we can look at existing resources and try and make use of them, the better. And I thought the suggestion about schools, you being able to use school buildings out of hours, I think the same for unused land, really. And I think mental health trusts, community clinics, GP practices, could be encouraged and should be encouraged to look at how to make use of that, to enhance not only individual well-being, but community well-being.
Indeed. Okay, right, Salma Yasmin.
I mean, I totally agree with everything I've heard, and I guess just to add to that, that shifting from an illness model and the emphasis on spending all our resources on people who are at the extreme end to actually thinking about a mental wellness model and investing in creative health approaches and partnerships that are in place in a sustainable way will fundamentally improve health outcomes, but also productivity in our communities, and particularly where we know that there are communities where they're less served or they're experiencing inequalities. So really supporting and enabling and valuing creative health approaches and partnerships and making them sustainable.
Well, that was a very productive little 10 minutes, that was. So thank you very much, all of you. And we've also, I hope, got the recommendations of 42nd Street. I don't know, but I'm sure we'll have that as well. So it only leaves me to say a huge thank you to all of you for your really massive contribution in this session. I've certainly learned lots and lots, and certainly agree with pretty much everything I've heard, I think, today. So thanks a lot, everybody. And I think I'm handing over to Alan, am I, for a minute?
Well, only, Molly, for me to thank you, really. Super of you to take the chair with your characteristic combination of firmness and sensitivity, but also to add my thanks to everybody who's presented. Deb's absolutely inspirational. People from 42nd Street, absolutely inspirational, and just so down to earth and sensible. And our panelists abundant with insight and good thinking. I think it's been a very rich, very, very valuable discussion. Frustrating, really. We're trying to answer these questions. There's so much we could say. The questions were so good. Thank you to the chatters and the questioners for sparking off a whole lot more thinking, which we didn't have time to do justice to, but you've got us thinking, and we'll absorb all of that into the process of the review. The roundtable that we're going to have on cost and value will be a joint production with the Centre for Cultural Value, and a lot of what's been said this morning about questions of funding and finance and sustainability of these initiatives, and ultimate questions of value, like, for example, those that Sue Stuart Smith was so eloquently reminding us of. All of that will be considered. So you've been a launch pad, and we take it from there, and we hope to be able to make recommendations to government so that they do look holistically at these issues instead of the characteristic fragmented, divided, partial approach of policy making. And as Kears and Sue Bailey reminded us, we've got to, through this process, provide a voice for a whole lot of people whose voices commonly are very little heard. 42nd Street is doing that, but it's far more extensively needed. And we take the point that we've got to be truly representative in expressing what it is that we need to express. And if we can be truly representative in the way that's been advocated, there's so much better a prospect of actually being able to persuade government to look at things differently, even in these very hard fiscal times, when there's going to be a lot of negativism and a lot of defensiveness and a lot of fear around. That it actually is all the more opportunity for creative health if we can express it and if we can convey it as we need to do. So this has been a great start, the first of our roundtables, and thank you very, very much, all of you.